Environment, you put people in a certain environment, they behave a certain way. If you want to look at health disparities, you'd look at, say, age distribution. The second thing you might look at is gender distribution. And then third would be sort of a racial, ethnic differential between the two counties. Finally, you might look at socioeconomic status. And if those were similar, then you'd have to probably look deeper, and that might involve doing different surveys to look at risk behaviors, what people do, whether they smoke, exercise, eating habits, and so on.
I don't go to doctors. I don't take medicine at this moment in time, and I'm not a kid. But I'm an anomaly around here also, because everybody that I know does take several pills a day, and I think that's a lifestyle that's inherent in the community. I was born and raised here in Murray County. I've spent a lot of time away from here. I've been back about 9 years. This is probably the worst I've ever seen it in my entire life. The unemployment is probably 15% or better. Around here it was a carpet mill or nothing. And right now there's an awful lot of nothing going on.
I have read that socioeconomic status can do it, that people who are poorer tend to want to use the fast food restaurants because they're cheaper, or they're supposedly cheaper. And therefore you may see a greater use of the fast foods among poor individuals.
A lot of diabetes here, a lot of sugars they call it. It's the catch-22 thing. You can't exercise because I'm unhealthy, because I can't exercise because I'm unhealthy, because I can't exercise because of my diet, basically.
But there's a huge confounding factor there that if we look at education and say obesity, obesity is related to socioeconomic status. Education is also related to socioeconomic status. So which is it? Is it education that leads people to healthier diets, or is it the socioeconomic status that they can achieve with a better education that means that they can have healthier food choices than if they aren't, in that they haven't been educated and don't have the job or the better jobs that give them a better lifestyle.
The two counties compare very close to each other. I don't know that people here are more prone to taking better care of themselves, or they're just healthier as a whole. Most of the people I know are pretty health conscious. They care about their health and try to do the best they can. And of course, there's those that don't, but I think for the most part, people try to take care of themselves.
What motivates people to try to understand, observe patterns is, probably someone coming along asking the right questions and sort of pushing the issue a little bit. It's like a doctor when they do a blood test. You presumably want to act on the results of that blood test when you get the result if it's abnormal. So if you do a study, presumably you'd want to act on it.